just important to be involved in your professional organization, not only because they set the standards of practice, the code of ethics that we have for nurses is developed by our organization.
Your power comes from this fact. In America, society moves forward in groups.
I think being a nurse is one of the absolute best ways to be a dramatic change agent with others in a community or in a nation.
What I always found about coming to the ANA meeting was seeing the leaders of the day and hearing them speak and listening really to new ideas.
And that's how I try to describe it, as an incubator for leadership, that you get tested out in so many different ways. And to me, the ANA is a wonderful incubator.
I think it's very important for nurses to be challenged to use the knowledge they have, to provide the leadership they have, to provide the advocacy that they are able to provide, to be the patient's advocate, to be the patient's defender, to make decisions and stand by those decisions.
Today, the nurse, without a doubt, is often the only advocate that the patient has.
The trust that patients give to you and the intimacy that they allow it's a profound gift.
I see us being leaders in public health too, and not just the deliverers of the care services, but the deciders of the care services. And I see hospitals as being a quick, sweet stop-in kind of operation run by nurses, managed by nurses. I see us managing the journey of the patient's life. That's my vision, is one of decision-making, one of leadership, and nurses understanding where we lead.
And that's what I have always loved about my participation in my State Nurses Association or in the ANA, and that is that we are a force for social good. We have always been a patient-focused, family-focused health profession. We are having a tremendous difficulty with diabetes, hypertension, obesity, all these things that are lifestyle problems, because they're also social problems, they're education problems, they're poverty problems.
And ANA has taken a position in support of health reform. We always have pursued those kinds of issues.
Healthcare needs to dramatically reform. Nurses need to be in a completely leadership role about some parts.
This is a wonderful opportunity for nursing to join together and for it to say, and to line up with, some people will say behind ANA, other people will say with ANA. I'm for just line up and keep the focus of the patient in mind. We need an organization that covers the waterfront. The only organization that I see covers the waterfront of nursing is the American Nurses Association.